Good morning, Lisa. How are you?
Morning, good, Jana. How are you keeping?
Can't complain, can't complain. Alive, well, and happy. A lot of parents have been asking us for information on the flu mist vaccine that they are adding to the school schedule this winter for the senior infants. Now, I haven't heard that it's coming out to other age groups, but parents are also contemplating whether to take their whole family into the GP or pharmacy to get their flu mist. So we've been asked to help parents decide whether they should or whether they shouldn't. So we put together this week a very short 5-minute presentation, which we shared out yesterday on our YouTube channel, which is Natural Women's Council, to really allow parents to make their own informed decision. Whatever that decision is, it should be a fully informed decision. So we'll walk through the presentation with some of the data, and then we can have a chat and give our views as well, and even share a natural recipe that I made this week, because I do believe that nature is such a powerful thing when it comes to healing the body. And I know, Lisa, you're a qualified acupuncturist as well. And I'm qualified, I do a lot of coaching, including health coaching, career coaching. I'm a qualified life coach. And, we do believe with the Natural Women's Council, the natural health has such a powerful place in the family, but it's not something that is really promoted by the government or media. For whatever reason, perhaps natural health doesn't make as much money, and people stay healthy. And certainly people don't make money off healthy people. It's sickness that makes a lot of money for many companies. So
absolutely.
Great. Well, I'm going to do a share screen, and I'm going to bring up the document that we created as well. So I'll share that now. One moment. Okay, great. So let me know when you can see that. Can you see this okay?
I can see that now. Yes.
Great. Okay. So we have this document we put together. It's not a presentation because unfortunately Zoom wasn't compatible with presentation. So it's in a PDF, but you can look at our YouTube channel as well, and it has a presentation that's 5 minutes. So this is about the flu mist vaccine that's being rolled out in schools, and this is really an information packet for parents, but also schools. One thing that the Natural Women's Council and Irish Education Alliance, Parents' Rights Alliance, and Lawyers for Justice Ireland are doing this weekend is emailing all. I think there's over 3,000 primary schools are going to have this presentation, and also a letter showing them what we have for data. So the schools should actually be questioning why they're allowing the pharmacy or the HSE in to do this. So we'll go through the data here. So this data as well, just want to give a huge shout out to the Health Freedom Ireland, who shared this data with us. All data is from government sources, and they've been pulling this together over several weeks it's taken to compile this. For more information as well, there's more comprehensive information on the flu vaccine as well as other vaccines on healthfreedomireland.com. Many of you may know who Health Freedom Ireland is. It's a group that's been around for several years. They're a non-profit, voluntary and advocacy group dedicated to providing primary sourced scientific information and data around all things medical, including the immunization, or some people refer them to as vaccinations or whatnot. Their aim is to provide informed consent to allow Irish people to make safe and wise choices around health and well-being. This information is being provided to parents, as well as all schools will have this to show the data and also the risks associated with both influenza and the flu vaccine for children. So, a lot of us, when we look at things with our family, it's weighing up the risk versus the benefit. So, if you kind of put your risk analysis hat on, you say, okay, what is the risk of doing something? What is the benefit? And see which weighs heavier. So hopefully this data today and information will surely help people weigh that up for their own families.
And I think it's important to point out the HSE and their press releases and their interviews have focused on what they believe are the benefits, but they don't actually talk in any of their information or when they're being interviewed about risks and downsides to it. So I think it's important to present a balanced approach in discussing it. So I think that's the gap that we're trying to fill here today.
That's a really good point, because we constantly hear the adverts. Every time you get in the car and put on the radio, you hear all the adverts pushing all the get your booster, get your flu shot, get this, get that. It comes to us in the school communication system. RTE talks about it. It's just pushed in our faces 24/7. But what's not pushed out to parents is the data and the facts behind it to make it an informed decision. So we're all about informed consent, informed decision. So whether you decide to get a vaccine or whether you don't, the most important thing is you have that information to make the best informed choice. So that's a really good
and I think, sorry, what we're trying to do is, I suppose all that we're hearing from the HSE and other sources is safe and effective over and over. Like, it's a bit of a mantra that you're not supposed to peek behind that veil. You're not supposed to find out, you know, okay, can you give us some data on that? Or what do you mean by that? We're just told over and over, safe and effective, and look no further. And I think there's actually a third consideration that we'll definitely be touching on here, which is it necessary? So, you know, there's a safety issue, there's an effectiveness issue, but the very first question is it necessary? So
great point. Great point. So the objective in this presentation here, which is about a 5-minute presentation on YouTube, for anybody who wants to share it out, it's on the Natural Women's Council channel. It's also been on our Twitter and our Telegram, is really just having as many facts as possible that is not always shared by the publicly funded HSE. So what we're going to talk about is, what is influenza? What is the HSE recommending? We've also, through our networks, had many questions come in from parents. So I think we have about 7 questions that have come in that we're going to answer today. We talk about the risk of influenza to children and the child flu vaccine impact on influenza deaths. So what is influenza? It's many more syllables than the word flu, and it is a little different than flu. It's a viral infection that produces fever, chills, sore throat, muscle aches, and cough that lasts a week or more. People tend to use the term flu to describe any kind of respiratory or gastrointestinal illness, but influenza is usually associated with a more severe illness. It lasts longer than a common cold. So we probably all had influenza. I remember I'm a child of the 70s and 80s. I'm aging myself now, and I remember when we had influenza back in the day. I grew up in Maine. It'd be 30 below zero, and you'd be, you know, in your bedroom sleeping, watching the snow, and we had chicken soup. We wrapped up in blankets. Sometimes we opened the window and had fresh air come in. And I grew up in a family with Finnish roots. So we had a wood-fired sauna at the house. And if I was sick, I'd be thrown in the sauna and then thrown in the bed with the window open, curled up in a blanket. A few days later, you're feeling 100%. And the other thing to note is, you know, sometimes this produces a fever. And I want to just touch on fever from my own personal experience over my 8 years as a mom. Many parents, including myself as a new mom, would have been terrified of fevers and rashes. You see a fever, you look at the thermometer, you see 40 degrees, and you start to panic. You start to wonder about, you know, those seizures that can happen, and, you know, organ failure from fevers and all of that. But I found a really good doctor, a functional medicine doctor, and his best advice, which has stuck with me to this day, is fevers and rashes are good. That's the body's God-given immune system pushing something bad out. So, for example, with my children now, which is different than I would have approached it 8 years ago, if they get a fever, unless they're in absolute pain, we don't give them medicine to reduce the fever, because their body just sweats it out. And when I used to give them the Calpol or Nurofen for temperature 7 or 8 years ago, the temperature would last 5 or 6 days. The bug would last a week. Whereas now, they sweat the bug out, and within a day or two, they're 100%. It goes away a lot quicker to let that body push out that badness. So even my little 8-year-old the other day had a bit of a headache, sore throat, and a temperature. And I said, look, you have a sore throat. I'll give you a little pain relief, because she was uncomfortable. And she's only 8. And she said, Mommy, I want to have no medicine. I want to sweat the bug out because it will go away faster. She went to bed, slept an hour and a half, sweated out, and woke up flying. So it's instilling that, you know,
sleep is amazing. It's so healing.
Absolutely. Sleep and chicken soup and vitamin C and fresh air. I mean, we'll talk about how to keep healthy at the end of this, but just wanted to touch on the word fever there, because it's something that makes a lot of parents, particularly new parents, panic. So HSE, what is the HSE recommending? The HSE is recommending the AstraZeneca Fluenz Tetra nasal spray, also known as FluMist vaccine, on an annual basis from the age of 2. And it was just put on for the first time ever onto the school program schedule in 2023 for senior infants. So my kids are not in the senior infant cohort, but our school is unfortunately offering this for the senior infants, and it's on a Monday, which is even riskier than doing it on a Friday. And we'll talk about why that is as well. So that's what's being recommended here. So I don't know how much money is being pumped into this program, but certainly if it's funded and it's free, it's our taxpayer money going into this. So we've received questions from many parents, but have no fear, we have some answers. So parent question 1. So the first question that came in is, what is the risk of influenza without a flu vaccine? I want my kids to stay healthy, particularly over the Christmas holidays. What is the risk without the flu vaccine? So the lovely team on the Health Freedom Ireland advocacy group has provided this data. It all came from government sources. This data is a decade before the influenza vaccine for children was even introduced. So this captures data from 2003 to 2012. To create this slide, I've seen all the back end data behind it. There's hundreds of pages that these ladies went through the last several weeks to get to this data here. It's all been verified. So if we look at it, the risk of dying for all ages, this isn't children, this is all ages, from influenza in Ireland in the decade before influenza was the vaccine was introduced for children, was 1 in 1.08 million. So risk of dying was 1 in a million, and that's across all ages, right up through to the elderly, including all the vulnerable. An average of 4 deaths per year for all ages. 5 deaths in 10 years, which is 1 death every 2 years for all children under 14, and 3 deaths in the under 14s was the data that was captured. So 3 deaths in the under 14s were for under 4-year-olds, 1 death every 5 years. So that just shows this was life before that vaccine was introduced for children. So the risk for children here, you can see, is, remember, it was 1 in a million for all ages. For children, 1.1 in 1.8 million. So very, very small risk for children of influenza before the vaccine. So,
and what we don't know, Jenna, is those few poor children, did they have underlying health issues that, that were factors in their death as well? So
yeah, exactly.
Don't know. This data doesn't tell us, but I've never heard of a very healthy child succumbing to the flu. So
not at all. And if we look at even the way that the COVID reporting was done back in the day, when I started looking at a lot of that data in 2020, and they tracked everything. I think Dr. Varadkar even had said this.
Admitted it.
It was all tracked as a COVID death, even if there was something else involved, like it could have been a car accident, it could have been someone who had a heart attack, but if they get a positive PCR, it's a COVID death. So I'm not sure if the flu is the same type of reporting that they did in COVID, which certainly drove those cases up. So parent question number 2, I feel like we need a drum roll here. Parent question number 2 is, has the rollout of the flu vaccine for children reduced the number of influenza deaths in children? Now, keeping in mind they were very low to start, but let's look at this data. So before and after the flu vaccine rollout, and this is for the under 14 group, the risk of death in the decade before the influenza vaccine was introduced for children, so this is 2003 to 2012, was extremely rare. So we looked at that on the previous table there, 1 in every 1.8 million children. Now, in the years after the vaccine, which was 2013 to 2021, this risk increased to 1 in every 618,285 children. So that is more than double. The death rate is more than double in the years after the vaccine. Okay, parent question number 3 is, this is we heard a lot about this in the days of the COVID, is protect the elderly, protect the vulnerable. you protect granny, etc. So this question did come in from parents: is we want to keep the grandparents safe. Did the rollout of the influenza vaccine for children reduce the overall influenza deaths? Let's have a look. Okay, so total influenza deaths for all ages in the 8 years after the vaccine was rolled out for children, which was 2013 and 2020, was 481. That's an average of 60 deaths a year. And this is all age deaths. This includes the elderly, the vulnerable, etc., all ages, that's 60 deaths a year. This is a 15-fold increase on the average, which was only 4 deaths per year in the decade before the vaccine was rolled out for children. So in the 2003 to 2012, there was only 4 deaths a year. It increased 15-fold after the vaccine was rolled out for children. So that begs the question of, would I want to give my child, who, remember, we talked about the risk of influenza, one in 1.8 million, would I want to give my little children a vaccine to protect granny when actually there's been a 15-fold increase in overall deaths after the child vaccine was rolled out?
So I think there's just, the points are that granny doesn't want their little grandchild to take anything that could, adversely affect that. So we have to remember, really, from granny's perspective, they would do anything to protect the child. And we'll discuss this further on. There's an issue of shedding. So it could well be that little grandchild will actually endanger granny through shedding if they receive the vaccine. So we have to keep that in mind. And then, yeah, certainly this data here begs the question: does the flu vaccine actually increase the incidence of both the disease and the effect of the disease, the impact of the disease? I suppose the severity of the disease is the point there. So it certainly is worth diving into this data here and saying it does not appear that this is going to protect granny or the child, and could possibly have adverse outcomes for both.
Yeah, 100%. Now, if the data, now personally, I believe that, I don't believe my children should be used as a shield, or my children's job is to protect anyone else. They're my children. My job as a mother is to protect my children. But for the parents who may have thought, let's just say that flu deaths were in the thousands, but when the vaccine rolled out, they went to 0. People might think, gosh, it is actually stopping it. It is stopping deaths. They may consider giving their child the nasal mist to protect granny. But in this case, the data shows that it actually was adverse and did not stop overall influenza deaths. It actually increased them 15-fold. Now, a little note on the bottom, you'll see there has been some additional surveillance, tracking cases and monitoring this sort of thing. That could account for some of it, but does it account for a 15-fold increase? I struggle to believe that reporting was so bad before that the only increase is due to the better reporting. Certainly it wouldn't have been that poor that it would have made a 15-fold difference, in my view. And I've looked at a lot of data in my life. Parent question.
Yeah, and just to say there quickly on that one, Jen, it looks like from around 2014, they started lumping the flu and pneumonia data together. So yeah, the question is, are we looking at respiratory diseases, a category of them? Or are we looking purely at people who have tested positive for flu using a test? So a lot of questions there.
Really good point. And the fourth parent question that came in is, well, how effective is the influenza vaccine? How effective is it? So this is a lovely graph that the HFI team put together, and it shows by year. So 2009 right up to 2022-23. And it shows the effectiveness is most years less than 50%. In fact, it's worth noting that the US Center for Disease Control, the CDC, they withdrew the vaccine in 2016, right here, due to the ineffectiveness. So if we just revisit some of the data we've looked at so far, children are very low risk for the flu as it is, or influenza. The vaccine actually increased the overall, since the vaccine rolled out for children, the overall influenza deaths increased 15-fold. And then we look at the effectiveness, less than 50% effective. So potentially a parent could be giving a child a flu mist vaccine that they don't need, It doesn't stop overall deaths, and it's less than 50% effective. I mean, a 50-50 chance, would you really give your child a drug if there was only a 50-50 chance it would even work? I personally wouldn't as a mother.
No, and I think what's interesting on this graph to point out too is the 2020 to 2021, we have no data for the flu because we were officially told the flu had disappeared. And what's important to note is that it disappeared because they stopped tracking it. They stopped testing for the flu during that period of time. So just so people are aware, it wasn't that people were being tested for the flu during that time and it was all coming back negative. They were testing only for COVID during that period. So I suppose keep that in mind, parents, when you are looking at the data from the government. They will test for what they want to test for. If you're only looking for one thing, you will only find that thing. So we can ramp up what we want to find and we can ramp it down. And 2020, 2021 was the perfect evidence of that. So, you know, it's why weren't we testing anymore for flu?
Very good point.
We
I
didn't
always
want
think
to find it.
You know, that song, I always think of that song, video killed the radio star, COVID killed the flu, right?
Yeah, it did. It did.
Parent question number 5 is, what are the risks of the flu mist vaccine? We were asked about, is it a live virus and can it shed on others? So we have an answer on that. So the risks from a shedding perspective, this flu mist that the HSE is offering for the senior infants in school, and also being done through the chemist and GPs, if people would go there, it is a live influenza vaccine. So this is actually a live virus. Live virus vaccines are known to shed. So for people who haven't heard that term shed, this is when an individual releases or sheds the components of the vaccine. So that live virus, they release it either inside their own body or outside of their body. So vaccine recipients can test positive for flu in the days following vaccination, and they are advised to avoid contact with immunocompromised people. So for example, the other question I would ask is, we know flu season starts around, I think my kids already had a little bug in October, when the weather turns and they're back in school mingling and all that. So the question is, if flu season starts in October, why is the HSE going into the schools right before the children break for Christmas holidays, when many of those children are going to be around extended family, around their grandmothers, grandfathers, vulnerable people, including pregnant women? Why would they be doing it just before the Christmas holidays when there's a live virus that sheds that could make others sick? We can certainly expect a big outbreak over Christmas if this happens, can't we?
We can. And I know when I looked into this, Jana, back in 2020, I was doing a bit of research and found then that the CDC recommended that the flu vaccines have to be given by October. If you don't do it by October, you're really missing the flu season. So yeah, we're in middle, at minimum, the middle of the flu season. It does start in October. We're week 46, I think, for surveillance on the HSE Influence Surveillance Week. So yeah, what is this all about? Why are we giving little children a shedding immunization just prior to school breaking up?
Yeah, very good question. It's definitely one that I would ask. And I know I've sent many emails to my children's own school about this. I've even sent a link to a pharmacy. I think it was Sheridan's Pharmacy actually had that it's not recommended for people who are, you know, children who have asthma, people who are going to be around vulnerable people, people who have weakened immunes. This vaccine is a live virus. It can actually not only make them sick with the live virus, but it can shed and make others sick. So that's definitely some questions to raise there. The risks reported. So what are the risks? So everybody should know now who the World Health Organization is, led by Tedros, heavily funded by Bill Gates and many others who profit from these vaccines. The World Health Organization has a VIGI access database. Now, one thing that's really important to note is that a Harvard study showed that only about 1% of adverse reactions, 1 in 100, get reported. But from the 1% that is reported, here are some of the risks that we will share. on the Vigi Access this is for all influenza vaccines, not just the children's ones. They've reported over 300,000 adverse effects. 1,611 deaths were reported, but this data was quite hard to find because, oddly enough, they report deaths under general disorders. So the death is just a general disorder, but we did find the HFI team,
it is the final disorder.
Exactly. So the HFI team were able to peel that out and get that there.
And well done to them for finding that.
Yeah, they did a fantastic job. This is a really short presentation, but it was weeks and weeks worth of data analysis that's been verified from the government reports that we have here, the Central Statistics Office as well. In the WHO Vigi Access database, they reported over 7,000 cardiac disorders. So much like we're seeing with the so-called safe and effective COVID vaccine, that also has many, many cardiac disorders that have been reported with the COVID one, and that's the same as that we're seeing from the influenza one. Nervous system disorders, almost 85,000 nervous system disorders, including nearly 4,000 of the Guillain-Barré, I pronounce that wrong every time. So that's quite a serious syndrome. Anyone can certainly look that up for themselves. But, you know, so the question is if there's only 1 in 1.8 million chance, 1 in 1.8 million chance my child's going to have a death from the influenza. And we know that the vaccine, from the data we shared, does not stop. In fact, it increased it 15-fold, deaths across all ages since the child vaccine rolled out. And there's a risk that if I give my child a vaccine like this, that the data shows they don't need, the data shows it doesn't protect granny, I'm going to risk giving my child a nervous system disorder or a cardiac disorder. That's not a risk personally when I look at risk benefit that I would take, but it's about everybody making their own informed choice. So we'll go into this nice visual here as well, put together by HFI. This is a really good one. The nasal flu vaccines, these are listed as common side effects, and these are the ones that the HSE are pushing into schools. Runny nose. And if we look across at the RSV symptoms, runny nose, reduced appetite, that's for both, fever, sore throat, cough, headache, and rash. So isn't it strange that the RSV symptoms and what we're trying to, stop people getting sick is actually also a side effect of the nasal flu vaccine? There are studies indicating that the influenza vaccine can also lead to an increase in respiratory virus. And that's also very strange. We've been seeing all over the mainstream media in Ireland about the increase in the RSV cases. So could the RSV cases be going up because they're pushing the nasal flu vaccine, which has the same side effects? That's a question that needs to be asked.
Yeah, certainly. And parents, if you do give your child or consent to your child having this vaccine and these symptoms come up, you'll have no way of knowing, was this, what they kind of call a wild virus, disease, or was your child injected, or did it go up their nose and cause them to get sick? And it is the case currently that the only polio virus known to be circulating, and I believe that the WHO confirmed this, is the vaccine-derived polio virus. So what we have at the moment is the only way you can catch polio, my understanding is, it is not a wild virus, natural virus. It is the virus from the vaccine is known to be the only virus that is causing polio. So, it just leaves you not knowing, well, where did this come from? Are we actually creating some of these conditions or increasing the numbers? So,
yeah. And it almost begs the question that if these, if, like you said, with the polio, if there's not a wild one and it's coming from the vaccine, and the nasal vaccine potentially could be causing all of this. We mentioned earlier in our chat that, the government, the pharmaceutical companies, doctors, they don't make money off healthy people. I haven't been to a doctor in years, neither have my children. We're not paying all those doctor visits. We're not paying for all the prescriptions. And they don't make money if people are healthy. So if you look at all of this information, it begs the question, do they want people sick? Do they want people to get sick and have a fatality? Looking at some of the data and also what they're pushing, that begs the question there.
We've both worked for multinationals, Jana, and it's just a fact to state that, you know, they're profit driven machines, and they're not there to make anyone happy or well. And you have to have, you know, a secondary school level of understanding of business to realize if your business is medical, your profit isn't in healthy people.
That is,
and you know, that's just the way it works.
and we've all had our awakening before. I'll just kind of divert a bit and tell a personal story. So, you know, my children, I didn't do my own research when I was a new mom. I was very much blindly trusting the doctors. You'd go into a doctor and say, well, should I get my kid, you know, the 0 to 12 month injections? Absolutely. If you don't, they're, you know, they could die, they could lose limbs, become blind, deaf, sterile. And you hear all this and you think, oh my gosh, I don't want to be the mom that doesn't do it and I'm irresponsible. So my kids had their 0 to 12 month injections. They did have some reaction, not a serious reaction, thankfully, but I had them tested, and I did a heavy metal detox because we had some issues with sleep. My son for 3 years was restless sleeping. He was in my bed for 3 years. He also, every afternoon, one of his ears would go quite red. When he was a baby, the GP told me that my son would be one of those children who will always have ear problems, probably always have ear infections, may need grommets and surgery. And he was 13 pounds on his due date. Luckily, he was a 10-pound preemie. So when he was all squished up, the doctor said his ears might have been damaged or who knows what. But I didn't listen to the doctor. And that was the first time when my son was 4 or 5 months old. He had an ear infection. And it's the first time I woke up and said, I'm not listening to this doctor that my son is going to have chronic ear infections and be on antibiotics and need grommets and surgery. I took him to an osteopath. I've taken him to kinesiology, and I've treated him naturally. And he's 5.5 years old. He has not had an antibiotic or been really sick since he went to the doctor when he was 4 months old for an ear infection that was most likely because he was cutting 8 teeth at the time. So may not have even been an ear infection. So that was my wake-up call. And another wake-up call I had is my daughter one time at night said, oh, mommy, the lights are hurting my eyes. And I put her to bed. She had a really high temperature, felt a bit nauseous. And then I said, oh my gosh, the light's hurting her eyes. That could be meningitis. I just hear light sensitivity. So I peeled her out of bed. She was probably only like 2 or 3. Flew her over to the K-doc or knee-doc, whatever they're called, those off-hour service. And the doctor looked at her and said, oh my goodness, she has a big upper respiratory ear, nose, throat infection. And he sent me home with a big shopping bag full of antibiotic, steroids, and an inhaler. 3 prescriptions in a bag for my daughter because she apparently had this raging infection. I didn't give her the drugs that night because she wanted to sleep and she was eating and hydrated, drinking, everything was great. She woke up in the morning. She had no sore throat. Temperature broke. She felt 100%. Those bag of drugs went right into the rubbish, and I contacted the doctor and said she didn't need any of them. So that just showed me how quick they were to push 3 different drugs on my child. And that was my wake-up call. Now, I wish I woke up 0 to 12 months when they were babies, because I certainly would have done more research on the childhood vaccinations. But I'm learning more and more. And that was probably about 6 years ago. I had my wake-up call with the pharmaceutical industry and how they're profiting off giving these to children when they may not need them. So that was a little diversion, but we'll go to parent question 6. What poses the greater risk, influenza disease or the influenza vaccine? So let's look at risks from influenza here. This is all pulled from the Irish Central Statistics Office and some of the global data on the risks from influenza. So the risk of dying from influenza, for example, in Ireland in the decade before the first influenza vaccine was even introduced, you see on the right, all ages, extremely rare, 1 in 53,000. Under 14s was 1 in 1.8 million. And then
Jana, sorry to cut across. It probably should be said, even then, the extremely rare, we're probably talking about very elderly people as well. And it was always a disease that was only fatal mainly with elderly people, and immunocompromised people. Yeah.
Really good point. And the risk of dying from influenza in Ireland in the decade before the childhood vaccine was rolled out, which was 2003 to 2012, again, one in a million. Under 14s was one in 1.8 million. So very, very low risk of dying from influenza. Also something to note is they were pushing the COVID death rate. I can't remember who was pushing this. I can't remember if it was NEFIT or who, but they said it was well over 3%. It was, much higher than the flu. Everybody needed the injection, but it came out that it wasn't over 3%. It was a very small fraction of that. So had people been given that accurate data, maybe they would have reconsidered getting that. But it's all really important to look at the data and the statistics here. So risk of dying from influenza in Ireland in the 8 years after the vaccine for children was rolled out. So then we can see it's 1 in 79,000, under 14s 1 in 618,000 there. And risk of admission to ICU for under 14s in Ireland between 2012 and 19 was extremely rare, 1 in 44,000. So we'll probably start to hear on the radio, we'll hear all the RTE propaganda pushing all these things is, the hospitals are in a crisis. There's many people on a trolley. We need to get the flu vaccine to not overwhelm the hospitals. We heard that with the COVID as well. We got to protect the hospitals from crowding. But look, 1 in nearly 45,000 even get into ICU for the flu, and that was between 2012 and 2019. Lisa may have lost connection there, so I'll just carry on and let her back in as we need to. One sec. So vaccine risks on the patient info leaflet. This is risk here of severe allergic reaction. That's very rare, up to 1 in 10,000. Reaction, nosebleeds and rash, up to 1 in 100. And the Guillain-Barré is frequency not specified, but these are risks that are right on the vaccine leaflet. I'm just going to see if Lisa is coming back in. One sec. Not sure what happened. We might have a technical challenge there. And let me see. Yeah. So I'll just continue to walk through this, and then when Lisa comes back, she can join us there. Okay. So parent question 7 is, should my child get the flu mist vaccine? So that's up to every parent. That's not up to us to say, don't do it, or yes, do it. That's up to every parent. Our mission is to provide you with the facts, the data, the risks, the benefits, so you can make an informed decision. And that's exactly what the Health Freedom Ireland group does. They want to get the information out so everyone has informed consent with every health and well-being decision they might face in their life. So we've shared what the risk is, influenza risk. We've shared vaccine effectiveness and vaccine risk. So everyone listening to this, you now have the information to make your own informed and empowered decision for your children and for your family. So what do you do if you don't want your child to get this vaccine in school or any other vaccines? We have some letter templates that the Lawyers for Justice Ireland helps support us with, and these letter templates can be found on www.irisheducationalliance.com or parentsrightsalliance.com. We'll have those as well. I've posted several of these on the Telegram channel. Natural Women's Council and also Lawyers for Justice Ireland have a Telegram channel as well. I'm going to admit Lisa back in. There we go. So those are some support here. We are working, one of our New Year's resolutions is to, hi, welcome back, Lisa. Welcome back. One of our New Year's resolutions in the Natural Women's Council is to get a website up and running and designed, but we do collaborate and partner with the Irish Education Alliance, Parents' Rights Alliance, and Lawyers for Justice Ireland, so we share platforms. But if anybody wants to throw in any funding for all this volunteer work we do, we don't get paid for any hours, but we certainly do need some funding to keep things up and running and designing like a website. So the other thing is, if you found this data helpful, the other thing that just launched, I went to this book launch myself, and it was absolutely mind-blowing. It was such an eye-opener. If you found this data helpful, and this data was just a snippet of the flu data that was provided to us to get out to you, there is a booklet recently published on childhood vaccines. There's a booklet. You can purchase the booklet on the website. This would be the best present you could possibly give to a new parent who is facing that decision of, do I give my child their 0 to 12 month injections, or do I not? So you can purchase that book, or go on to healthfreedomireland.com for the information on the childhood vaccines. So the last slide I will end on here before we just have a little chat is have a happy and a healthy winter. And, you know, my children are 5 and 8, and I think they could tell you exactly what keeps their immune system strong, because they've heard me telling them so many times is, you know, a good healthy diet. That's the first thing to do to keep your body strong. So I have a picture here in the top left of, you know, you get your vitamin C in as well. There's a vitamin C that I always keep in the larder. It's the only one I can find not made in China. It's Vital C, and I can post the link after. But when it's winter season, or if there's something going around school, or my kids are feeling under the weather, I give them vitamin C all day. High dose them with vitamin C. I put it in their juice. I put it in their smoothie. I make homemade ice lollies with lots of vitamin C in that. And tap wood, it's worked for us over the last 8 years quite well. The next is get your sleep. The body does heal itself naturally through rest. A good diet, and all of our lovely Irish farmers will appreciate this picture. It's eat a good healthy diet. You know, we eat our red meat, we eat our fish, we eat our free range chickens. We won't buy into a vegan diet here in this house, and nor will we buy into eating any crickets or any other nonsense they're putting out there. We eat our good homegrown food. We have a polytunnel as well. We produced our fruit and veg all summer long, mostly veg, actually, not really much fruit, and our herbs. And it's wonderful for the kids to go out, pick their own food, and bring it right to their plate. Amazing company that does polytunnels as well, to give them a plug. I don't get commission. KSB Polytunnels, amazing company who will come and set it all up for you. It's the best investment we made a few years ago. Playing in the mud. Get your kids out there, get your kids dirty. Don't be afraid of germs. Germs are really good for kids. There's been studies that have been shown that kids who grow up around animals, or kids that grow up around a farm, around all those lovely, you know, dirty germs, kids who don't use hand sanitizer. My kids never used it during the COVID. The kids getting down dirty and having fun are the healthiest, and some good exercise. And again, another a good diet there. You don't see any crickets or on that plate. So, you know, that's really what it comes down to. And also living without fear and anxiety. I'm a professional life and business coach and an NLP practitioner, and I've treated a lot of my clients who have suffered anxiety, be it from something in their personal life or even in their work life. And a big part of people getting sick is anxiety and fear. So if people run around and worry about getting sick all the time, and worry about keeping their hands clean, and worry about, you know, getting all these, you know, injections and mists and whatever, that actually is bad for the immune. The fear and anxiety are really bad for the immune. So get out there, have a lot of love, have a lot of laughter, get down and dirty in the dirt, and eat that big piece of medium rare Irish beef. So I'm going to stop sharing, Lisa, and then we can have a little chat as well. So hopefully everyone found that helpful. Again, I can't thank the team in Health Freedom Ireland enough. Very small team who put together all of this data on a volunteer basis. They worked weeks and weeks, many late nights, and we have, I mean, they sent us just a few packets. So what you saw today is a fraction of it. So you can go on to the healthfreedomireland.com website. They're going to be putting together a much more detailed analysis for you. But hopefully this information today will help parents make the decision whether to give their child the flu mist, but also help schools make the decision whether they are going to be allowing this in the school, particularly given the shedding risk that we clearly know about. it's not going to protect granny. If your aim is to get the flu mist for your child to protect granny, well, you saw the data here, it's not going to do that. It actually can shed on granny. It actually can increase the RSVs, respiratory viruses out there, and the cases of the flu. So use the data. And Lisa, do you have a little chat? Anything else you want to add? And
like, I think basically that was a lot of good information there. And if there was one thing I would want parents to go away with, is a sense of power, a sense of, I am the guardian of my child, and I can make these decisions, and I am empowered. I am intelligent enough to make these decisions. Look past all the government and pharmaceutical companies shouting, safe and effective, safe and effective. Start asking questions. Start taking that role on of a protective, slightly suspicious parent, because that is our job. It is too late afterwards, to say, I wish I had known. Like, the information is there, and I just know it's frightening and overwhelming, and parents are tired and they're working hard and worried about so many things. And thank God for Health Freedom Ireland, who have put all this information together. So please just have a sense of empowerment, have a sense of entitlement. This is your child. Nobody tells you what to do with your child. I think, we've lost sight of that, and it's not our fault. We have been getting messages bombarded that we must do this, we must do that with our child, and that we don't have rights over our children. So for me, the biggest thing is, we're not here to tell you to vaccinate or not vaccinate. We're here to give you information and empower you, and hope that you feel empowered to start that journey yourself, to start taking it on and looking into these things. It's scary. It's hard. I know, like, I just remember back starting to look at these things, feeling intimidated by people in white coats telling me what I had to do, feeling intimidated by the government message that, you have to do A, B, and C, and you're not entitled. Look past that. It's a little Wizard of the Oz, and start taking back your power, because you have it, and you have the intelligence to make these decisions.
That's great advice. You have the power, and also to trust your children's immune system as well. I was one of those moms 8 years ago that if my kid had the rash, or my kid had a temperature or a chesty cough, I was the first to say, oh my gosh, have to get them to a doctor. Make sure it's not a chest infection or whatever. And my kids haven't been to a doctor in years and years and years. And even this week, I shared a little quick YouTube clip. My daughter had a bit of a cough. It's going around school, and she's also runs in athletics and, swims and does a lot of exercise, and her cough sort of went to the chest a little bit. Kids can't express mucus the way adults can express it. So there's an amazing recipe I posted on our Natural Women's Council YouTube channel, and this is it. Cost about €5 or €6 to make a jug of it. We're halfway gone. So yeah, I just was researching how to bust the cough, and we boiled down some Irish Carrageen seaweed, some organic seaweed. It cost about €5 a bag at the health food shop. Boiled in threw in some turmeric root, some fresh ginger, local honey, and some cloves to make it warm and tasty. And we simmered it down for 15 minutes. We strained it and put it in here. Turmeric
looks gorgeous.
And it's gorgeous. And also a juice of a fresh lemon as well. So everything in this pot I already had in the larder. The only fresh ingredient we had to buy was fresh ginger, which we actually had anyway, and a fresh lemon. Everything else is in the larder to make this. Cost less than a tenner, probably about €6 or maybe €6 or something. And my daughter, after 2 days taking that, the cough is gone. Rewind 8 years, and I would have had her in the doctor. They might have said she needed an antibiotic or an inhaler or this, that, and the other, because I've been there. I've been told that by doctors. I treated it naturally. I trusted my daughter's immune system. And the other thing is, when kids get sick, every time they get sick or a bug, it builds their immune system. So if we keep suppressing their immunes with all the drugs and all the antibiotics and keep suppressing it, their body's not going to learn how to actually be a fighter. So, every time a kid gets a bug, and I remember when my daughter was in preschool, first time she's exposed to all these bugs, it was in the middle of the COVID times. She'd get, repeat things, but as they get older, they get less and less, because their body says, here's a bug. What am I going to do? I'm going to get a temperature. I'm going to get a rash. I'm going to fight it off with a bit of sleep and vitamin C. And their bodies are amazing. If only our bodies as middle-aged mamas off things like my daughter and my son. It's amazing. So like Lisa said, be empowered. These are your children. You do not co-parent with the government. You do not co-parent with the Department of Education. You do not co-parent with pharmaceutical companies. You're the parent, make the decision, but also trust your child's immune system. So I think that's a great thing to end on. So hopefully this was helpful, and we'll get this out to all of our networks. I'll just stop the recording now. One moment.